It's Kevin and it's Thea from RPH Ally. We're super excited to see you guys today. We've been doing our retail spaces in different retail community pharmacy kind of environments and dabbling in some different settings. Today, we're going to dabble into the future of RPM and see what we're kind of seeing with some legislation that's going forward, some major players that are making moves, and what in general you can do to stay ahead of that and to make sure your patients are taking advantage of the services that are available to them. We'll hit this reel and we will be right back. Thea, it's so good to see you. I feel like you and I have been running like a thousand directions, and I felt like your aura of like, hey, we got lots of things going on, but it's nice to kind of take a break and talk about something you and I love to talk about.
Yeah, it's been a whirlwind here with school ending, and the whole month of June is gone, and it's just been crazy here for sure. And I miss our conversation, so there's that. I love getting on the phone with you and talking about all things pharmacy, but most specifically for me is remote patient monitoring, care management services, and where the future of that takes us. So I'm glad to
Yeah,
be
we.
back.
Oh, me too. I mean, you and I were just talking about before we jumped on some of the things that are happening right now in legislation and how that could impact what's going to happen in the remote patient monitoring and or care management services umbrella. Want to talk a little bit more about that, Thea? What you were looking at?
Yeah, I was looking at the new model that CMS is putting out around the make care primary, I think is what the initiative is called. And it's in 8 states. They're getting ready to launch a 10-year program for care management services to really put the patients ahead of prevention. They want the preventative models of these programs to be the forefront of patient care, because the more we're in front of it, the less cost there is, right? And that's really what we need to think about as we move forward with where is Medicare going to be in 10 years, and what that cost is really going to look like, as the aging 65-year-olds are a huge population, but there's a lot of population that are moving into their 80s and 90s, and they're not passing away, luckily, or thank God, or I don't even know what to say there. Like, they're living longer, and it's a blessing, but could it be a curse? Because then who foots the bill for their care? And so when we look at these care management services and the fact that they're preventative maintenance services for those chronic conditions for patients, it's really helping the patient stay healthier longer and getting ahead of the problems that may get missed when you only see your doctor once a year or twice a year at most for that whole 7 minutes that you get to see him each office visit. That's just statistic. That's so scary to me. Like, 7 minutes, like, oh, we got to do better than this. But that's why CMS is getting involved with these care management services and really wanting to push this forward. I believe by the date, I think it's 2030, they want to have every Medicare patient in preventative care measures in these programs. So by 2030, that's only 6.5 years away. 6.5 years. And oh my gosh, it's almost, oh my, it's like, oh, half the year is gone already. Oh, that just hit me. That means only 12 paychecks until Christmas. Oh, my
Oh
goodness.
man, rack 'em up. Yeah. Yeah, no, I think that the what we're seeing right now in Make Care Primary is really an interesting next move. Only 8 states, like I said, a handful of states that are going to participate in a pilot-ish kind of setting, which is kind of odd to me in lots of ways. Thea, I mean, I feel like is a poor choice because whenever I'm advocating for things inside of pharmacy, the siloedness of this state does it this way, this state does it this way, this state does it this way, it doesn't just make it annoying for practitioners that are moving across borders. It really makes it difficult when we're talking about global utilizations of our skills and helping patients in nuanced ways, across these borders. And so I think that's, one complaint I have for it. But in general, the other big one is that pharmacists aren't listed as a primary member of that care team. So if anybody's out there and advocating for the profession, there we go. We need to be on that, period.
We need to get on that.
And so I think there's some interesting pieces, but where we can fill in gaps is really the incident to billing modalities, which you and I talk about, all the time on the show. And one thing that I was reading about and sent you a couple articles that we were discussing a little bit is one that was looking at what are the tea leaves saying when it comes to the future of remote care monitoring or remote patient monitoring. And that was really peaking at a couple of the big mergers and acquisitions that happened over the last few years. I mean, obviously, COVID was a big push, but even into 2022, there were still some major players getting involved. And we're talking United Healthcare, Cigna, and Humana, so the biggest of the healthcare individuals that are getting involved in buying up remote patient monitoring or telehealth services that are doing remote patient monitoring for lots of purposes. And you and I both know, Thea, that it's not necessarily they're going to bill for these services themselves internally, right? I mean, because that would be them pulling from their paycheck, which we can have a conversation on that later with vertical integration. But one big benefit are the insights that they're seeing, the data that they're seeing is monumental when it comes to two things. First thing is going to be, how can we increase the complexity of our individual patients? Because if folks don't know, that's how payers are getting reimbursed, and how they're setting up their contracts is based on the complexity of the individuals they're providing care for or coverage for. And so having those additional insights now gives them even more insight on how far can our dollars be stretched and how can we change our margins on those individual dollars. The other piece, we'll go more altruistic instead of dark, Kevin, on this one, is really with health benefits. Like, you're seeing that with more data, they can allow their teams to do more interventions. They can have more insights onto how can we move the needle on them going into the hospital again, or them needing increased acute care services. And they're noticing those huge benefits that are happening there. And so one benefit that they have, Thea, that you and I both know is in the future of RPM that I want you to talk about is they don't care if a device is necessarily approved. Like, they don't care if it's just blood glucose monitoring or weight monitoring or blood pressure monitoring. They're able to look at a whole slew of things that they're able to get data back from and be able to extract. What things in that kind of space and world, Thea, are you already using, and make sure you educate people in the CCM space, because you don't care about that either, to be able to pull that data back and help your patients that you think are going to be incorporated in RPM in the near future?
Yeah, I think the biggest one is around arrhythmias, right? Like, in the work around that, like the company, is it Cardia, I think is the name of it. Yeah, they're already having the fingerprint finger testing monitoring on an EKG, and your smartphones can do it, and different things that way. I think the heart, cardiac area has a huge reel of just so much stuff on the docket for approval for utilizing these pieces of technology that are now available to us like never before, to be able to get the patient's data, whether you bill for remote patient monitoring or not.
Yep.
It's the data that you're able to get from the patient and get about the patient that is going to move the needle and really offer the opportunity of catching an arrhythmia per se, if we use that as the example. But then being able to document the arrhythmia, get them in for testing, get it approved. Now you have a complex patient that then the care becomes even more important to look at and deem, attentive to by a team member, to be able to see how they're doing and what they're doing, and the new treatment regimens and all of the pieces that kind of align there to be able to further the care for the patient. So not only do you get to make the patient more of a complex patient because they need to be, but you're also building revenue for the office or for the facilities, because then you add on these other opportunities like remote monitoring that you're able to then capture how they're doing with it. Not only just that they have an arrhythmia, but then it moves on into how do we manage that, and what's that look like, and what meds are we going to do, and what their outcomes are on those medications as new starts and things. So it really just drives from one right into the other as you drive up, the complexity of the patient, but also utilizing the programs like Medicare has wanted. I think it's a huge opportunity for our future in our healthcare. And what I see is that most of the patients, to get to a patient level, and what they're feeling is they just need the education. They need to know what to look for. They need to know what to watch for. They need to know what they're eating is mattering. Like, they need the insight that you can give them in these programs, because you're able to spend time with them and be able to have those longer than 7-minute conversations with the provider or with the patients, whether face to face or telephonically. Like, it really is a huge impact on how the needle gets pushed for the patient's outcomes and health that way. So you're identifying early that there's a problem. You're building a complex patient kit. Now we have programs to help support them in that model, but then we're keeping them out of the hospital. And so the cost containment measures are being met there, as well as we can tell if they're adherent to their medications and, that their levels are coming down or going up accordingly, whatever they need. And that's going to drive your quality metrics and your value-based outcomes. And that ultimately is going to drive up the price as well, because we are meeting those outcomes. So there's a lot of different ways and aspects that you can see it moving and entwining into our healthcare system. It's like a gold thread. Like, yeah, remote patient monitoring is only one piece, but when woven in around all of the things that it touches, and much like pharmacists, we touch a lot of things that we don't get credit for in the healthcare society today. With how the patient is doing, we're weaving that gold thread through for better outcomes for the patient. And I think, remote patient monitoring is just going to skyrocket that golden thread to really pull it together for the patients and increase the outcomes for the patients and decrease the cost for us all. Because, if we're all Medicare age and we're all spending buku money because we're sick and not being preventative, then, it's going to be less for down the road and our kids aren't going to have it, and it's like, we've got to figure out how to cost contain, even from a Medicare standpoint, what that really looks like. And these preventative programs, do just that. And even like last year, 2022, Medicare gave chronic care management a 55% increase because they want people to use the program. They see the value in this. And that's why they're here now knocking on the door of this 10-year pilot for 8 different states. And even if you live in one of those states, that doesn't mean you can't go out and work with these patients and these providers. It just means that they have the option to enroll to help Medicare see this pilot through. But it doesn't mean every provider in the state is going to do that. They're not all providers are going to want to be on a pilot for CMS, because some people think it's under the eye, and they may get in trouble for other things they might be doing or not. I don't know. But like I could see a lot of hesitations from the practitioners in those states that are like, oh, well, it's just a pilot, it'll go away. Well, I don't think remote patient monitoring or care management, chronic care management are going away anytime soon. And, with the initiative of every Medicare patient in programs by 2030, we got to get on the roll here. We got to get this moving, and it's going to take a team effort to get that done.
Yeah, it's interesting. We sometimes, when we think about the future of something, we think like Star Wars. Like, how are we going to see lightsabers pop up here sometime soon? And that's not the case here. Even though reading a Mayo Clinic, kind of review of what's the future of like remote patient capabilities, and they talked about like the $6 million man and the bionic man and bionic woman, and some of those pieces are very true. They dove into how is CGM changing things as opposed to typical blood glucose, and looking at, hey, is someone going through escalations in their blood sugar levels at night or in the morning, and changing the way that we're dosing our insulins or other elements that we're using for therapeutic intervention. And I think the exact same thing can be said when it comes to sleep monitoring. For example, like we see a lot of things with arrhythmias and sleep monitoring that can start helping us with what? Seeing if someone has a sleeping disorder of some sort.
Right.
If that person has sleep apnea and that is causing or precipitating their AFib or some other sleep related issues like diuresis, for example, great. Yeah. We can start tracking that and seeing that very simple information that before you had to go into a center and sleep somewhere foreign and get a sleep study. And I think that right there, Thea, to me is the future of RPM. When you and I are talking about, are there simple studies or procedures that are being done that we can do in the home?
Yeah.
And utilize technology to bridge that gap. And I mean, you and I can rattle off a ton of things that we're going in and going, hey, there's a blood glucose check, or we're doing we have an individual that's going in to see what their cholesterol levels are, or whatever the case may be when it comes to laboratory reporting, that now we can start doing some of that at home with some of the checks. And there's now technology that's starting to be able to read the blood and do other things that are showcasing you're already looking at these levels. We can calibrate those, and we'll look at those in person kind of appointments and see what their actual levels are to make sure that we're accurate. But when it comes to long-term monitoring and progression and changes, I think there's the big shift in the future of RPM, is we'll be able to look at those on a trending basis instead of just having N of 1 during this month and two quarters later, 6 months later, N of 2, as the next, data point. We'll have thousands of data points to be able to look at and see and trend. And so now, instead of having a patient come in and we're worried, Thea, that they have hypertension, we put them on an antihypertensive and they had white coat syndrome, or their blood pressures are usually doing quite well. In fact, they're dropping a little bit too low during the day, and we had no idea because we took the blood pressure measurement right there in the office the one day. That's a huge burden on patients that we don't even realize that we're impacting, until you and I are talking to family members or patients going through it and really breaking down their chart and seeing what they're going through, going, oh, wow, you have AFib and it feels uncontrolled, but at nighttime you're having these issues. Maybe you have sleep apnea and need to go get tested. Great, we can check that remotely. Oh, you just got done with your discharge from having a stroke and they put you on X number of medications to treat your hypertension, but you're going home and you're noticing that you're hitting under 100 for systolic. Well, that's a problem. And now we can address it really quickly. So I think there's probably some of the things that, we're already doing with some of the blood pressure monitoring today, and we can do in the future when it comes to sleep monitoring and behavioral monitoring, to be able to make sure that we're checking these things and being able to get data points that we never could see at that level and scope.
Yeah. And I think that it's so much advanced because of COVID that they're being able to do telemetry at homes, to keep people out of the hospital when COVID was inundating the hospital systems and they didn't have enough beds. And they used remote monitoring and that technology even to the cardiac patients that shouldn't have been exposed to the COVID vaccine or virus. So it's like, it's out there and it is only going to grow, and it's up to our unbelievable imagination on how far it gets to go. Like, really, because I think there's people out there innovating every single day on how to advance this, because they know how much of a burden our elderly population continues to grow and is going to continue to be. We need to find a better way to be able to age at home. And I think remote patient monitoring offers, and even any of these care services, really add to the value of being able to age at home. And I mean, I think that's going to ease the burden for the nursing homes, and be able to, we don't have enough nursing homes today, let alone 5 years from now. Like, how's that going to look, and what are our opportunities today to start making an impact on that future for tomorrow's healthcare? It's going to be huge.
I think that's massive. The one last subject I wanted us to touch on, Thea, and I'll throw your way, is I've heard from some individuals, especially a couple of years ago, that because of the pandemic, this is going to be phased out. And we've seen multiple extensions of these pandemic related rules in the remote care services realm happen. Mm-hmm. And the most recent one, I believe, is from January of 2023 through 2024 is what it's currently looking at. Yeah. What are your thoughts there, Thea, on the future of RPM when it comes to billing and staying at the current models it is?
Yeah, I don't think it's going to change. If CMS is coming after it for, the make care primary, it's not going anywhere. And, we've only seen it go up. I mean, we have a little blip, like maybe last year, a little blip with the pricing going down for reimbursement. But for the most part, they have been throwing money at these programs because they know how valuable they are to ease the burden, ease the cost expense that's coming out of these patients, and really just offer amazing health outcomes to the patients. It's really a win-win situation for them. And I really don't think that they're going to change the model at all. I think you're going to see more value-based care incentives. Actually, I think it's going to get even more so with offering these services to the aging population.
I think that's exactly what I think. That we're going to see, as some fee-for-service elements are trying to be dissuaded over to a value-based reimbursement setting, like that will likely be the slight pivot, but not a change away from the practice, that's going on and the reimbursement that's happening related to it. It might just be pushed into another model for incorporation. But no, I love that. Well, I hope you guys enjoyed the future of RPM from us. Lots of things we could talk about with the Mayo Clinic. They were talking about one thing, Thea, that I just kind of laughed about that I think is amazing, but I thought, oh man, we're really going like far into the future. They were talking about, there is a company, I believe it was out of Italy, that had sensors that they put on a patient's forehead that allowed them to steer their own wheelchair with it and move it around a room. And I thought, oh wow, like we're really getting some amazing territory here when technology is able to enhance patient lives. But some of those movement studies I think will be really interesting in the future. The stuff that we need to make sure that we check boxes off on now, what is going on the life of Thea, and any programs you have coming up or offering to folks to make sure that they're aware of. And then you and I have a big soiree next week.
We do have the soiree next week. So I am working on my membership. So that is on the hush or the down low, or maybe not so down low now. But getting it out there and doing the thing so that I can share more about care management services with more folks, and really give them the opportunity to be able to move forward with a program. So that is in the works. Hopefully to have that up in the next, we'll say 6 weeks. I think I'm shooting for 3 weeks, but we'll see. We'll give myself a window here. And then I think it's going to be an amazing opportunity to get the knowledge out of my head and get it into a platform so that others can get it without having me be the bottleneck of having mentorship hours only. And so I think it'll be an amazing opportunity for a lot of folks. So keep looking forward to that. And then we have our soiree next week of over 20 speakers on, what is it, Tuesday, Wednesday, Thursday next week?
You got it. Yeah, Tuesday, Wednesday, Thursday, 3 to I guess 6:30 on the East Coast. No, it is 6 to 9:30 on the East Coast, but 3 to 6:30 for me and my West Coaster self. So that should be so much fun. I mean, the number of minds that we have there speaking, including this brilliant gal next to me, really impressive, and talking about what's happening in pharmacy currently and what's going to be happening in their given specialty over this next period of time will be really, really interesting. And especially when you talk about everything from pharmacogenomics to herbalism to functional medicine to deprescribing. I mean, the list goes on. So these kind of applications in every care setting, are really going to matter to us, I think, in the future, and give us an idea where we can start putting some emphasis. And also, I guess the one nice thing about it's going to be really intimate, and we're going to try to make it a ton of fun so you can meet people, get to know them, have a better connection with them. And so we can continue to collaborate after the soiree is over and we're done with our dancing shoes.
I love it. I love it. I can't wait for it to get here. I think we talk on Wednesday evening. We're up. I'll be talking at that point. So it'll be exciting. I'm excited.
Amazing. Awesome. Well, I hope you guys have a wonderful rest of the week. Hope you enjoyed the episode, and we'll talk to you all soon. Have a good one.